Feeling tired all the time? Out of breath after simple activities? Or maybe you've noticed your skin looking a little pale? These can all be signs of anemia, one of the most common blood disorders worldwide. Anemia happens when your body doesn't have enough healthy red blood cells to carry oxygen throughout your body. And without enough oxygen, every part of your body, from your brain to your muscles, has to work harder. In this video, we're going to break down exactly what anemia is, the common symptoms, how healthcare providers test for it, and the treatments that can help you get your energy back. And at the end, I'll share how you can connect with trusted providers through myprontohealth.com if you think you might be dealing with anemia. Let's start with the basics. Your red blood cells contain a protein called hemoglobin, which binds to oxygen and carries it from your lungs to the rest of your body. Anemia occurs when you don't have enough red blood cells, or when your hemoglobin levels are too low. Without sufficient oxygen, your organs and tissues don't function properly. This is why anemia often makes you feel weak or exhausted, even when you've had plenty of rest. There isn't just one type of anemia. Here are some of the most common causes. Iron deficiency anemia, the most common type. It happens when you don't get enough iron in your diet, or you lose too much blood from heavy periods, ulcers or injuries. Vitamin deficiency anemia, a lack of folate or vitamin. B12 can stop your body from making enough healthy red blood cells. Chronic disease anemia, long-term conditions like kidney disease, cancer, or autoimmune disorders can affect red blood cell production. Bone marrow disorders, diseases like leukemia or aplastic anemia interfere with blood cell production. Genetics conditions, disorders like sickle cell anemia or thalassemia are inherited and affect the shape and function of red blood cells. Understanding the cause is key, because treatment depends on the type of anemia you have. What does anemia feel like? Some of the most common symptoms include fatigue and weakness, pale or yellowish skin, shortness of breath, especially with activity, dizziness or lightheadedness, rapid or irregular heartbeat, cold hands and feet, headaches. The tricky part is that anemia can develop slowly, and in the beginning you might dismiss the symptoms as just being tired or stressed. But over time, untreated anemia can affect your heart, brain, and overall quality of life. If you suspect anemia, the first step is a blood test. The most common one is a complete blood count, CBC, which measures your hemoglobin, hematocrit, and red blood cell count. If results show you're anemic, your healthcare provider may order additional tests to find out what's causing it, such as checking your iron levels, vitamin B12, folate, or even looking at your bone marrow in rare cases. Pinpointing the cause is critical because not all anemias are treated the same way. Fortunately, anemia is treatable. Depending on the type, treatments may include iron supplements or iron-rich diet. For iron deficiency anemia, foods like red meat, leafy greens, beans, and fortified cereals can help. Vitamin supplements or injections, if the cause is low vitamin B12 or folate. Treating underlying conditions, for anemia linked to chronic diseases, addressing the root condition is essential. Medications to stimulate red blood cell production, sometimes prescribed for anemia related to kidney disease or chemotherapy. Blood transfusions. In severe cases, transfusions can quickly increase red blood cell levels. Bone marrow transplants, used for certain rare or severe cases, like aplastic anemia. The most important thing is to work closely with your doctor to find the right treatment plan. Anemia is more common than most people realize, but it doesn't have to control your life. By recognizing the symptoms early, getting the right tests, and following through with treatment, you can restore your energy, protect your organs, and feel like yourself again. If you've been feeling tired, dizzy, or just not like yourself, don't ignore it. Get checked. Visit myprontohealth.com to book an appointment and get professional guidance on whether anemia could be the cause. Your health is too important to put off.